and implementation experience among our parties here. I'm going to introduce Ted first, who is currently at USAID and is the Eastern and Southern Caribbean's General Development Office Director. Ted has also, prior to working at USAID, worked in implementation for a number of development partners. And since he joined USAID, he has worked in Ecuador, Afghanistan, of course DC, Morocco, and Ghana. And he has a very interesting perspective because he's going to give us the public health approach today.
Okay, thank you. So I'm going to go up here because I have got some slides I'm going to go through, and I'm going to try to be relatively quick. So this gives you a quick picture, and we'll have a better slide later that gives you a sense of what the Eastern and Southern Caribbean makes up for us. We go from all the way from St. Kitts and Nevis, which is up near the top of that, all the way down to the continent of South America. We touch on Suriname and Guyana as well. So we covered 10 countries total. So the public health approach. Basically, the Caribbean Basin Security Initiative has been very active. It's been our main driver of funding. It's a presidential initiative. It started in 2010. Initially, we were focused, as people have talked about, specific programs on workforce development, juvenile justice reform. We realized we could not demonstrate whether that was leading to any reduction in crime and violence. We could show that there were kids getting jobs, kids were getting back into school. We could see that there was an adoption of the language of juvenile justice reform, but we weren't really seeing major practices. So as we came to our end of our last strategy, which happened around 2015, 2016, we really began to think we need to really rethink how to do things. And so we embraced the public health model. So we thought, one, we're trying to do a number of the things that Thomas and others talked about today. We wanted to be evidence informed, so we looked at what was working. We really liked the idea of using risk-based models, so trying to look at how you measure risks. We were trying to look at how could we start to develop an evidence base. Over and over and over again, you hear that there's lots of, well, it's not lots, but there are evaluations of programs in the United States, maybe in Europe, but very little in the Caribbean or Latin America. So we're thinking, okay, we've got to really drive this. And we also connected this concept of sustainability. Because we're working in 10 countries, we realized, we can't continue to try to do things across all 10. We just don't have the level of resources. I think there's a suggestion this morning that there are a lot of resources. Our feeling is not that way. We're feeling like we're struggling for resources. So we had to make some tough decisions. We need to zero in. So we're not just going to pick in specific countries. We're going to pick which countries and then pick communities within those countries to sort of focus in. And we thought the idea was that by testing and proving what worked in a few isolated countries, that we could then scale up and replicate across the Caribbean. So we're constantly thinking about, every year we have what we call the technical working group of the Caribbean Basin Security Initiative. And so our idea is to use that as one of our platforms to sort of build the knowledge in the region of what works and what doesn't, and trying to bring examples of what works in the Caribbean. So like last year, for example, we were trying to highlight violence interruption efforts in Trinidad and Tobago, or look at what was going on with juvenile courts, so trying to use that process. And we had Chuck there to talk about a lot of some research we had funded on gang prevalence as well. So you all know what the model is, but that's sort of the approach we were taking and why we thought it was really important for us. The scope of the problem in the Eastern and Southern Caribbean. So been a lot of discussion today so far about homicide rates. You've heard a number of our countries that are named. This is data coming from the Association of Caribbean Police. So it's from 2011, so it's pretty old. But you get a sense, this is what we were looking at, Jamaica stands out, we don't cover Jamaica. The country that stands out that we cover is Trinidad and Tobago, but our conclusion was that Trinidad and Tobago had a significant amount of programming going on there. There's already the International Development Banks, Inter-American Development Banks, Citizen Security Program, which my colleague Risa had worked on before. We thought it was very effective, and we thought that we didn't want to try, there was not enough space for us to go in there. So we then, looking at this list, we picked St. Kitts and Nevis, which was pulled out as being the highest in our area, after even higher than Trinidad. We looked at St. Lucia, and then we looked at Guyana as well. The reason why we picked Guyana, you'd see St. Vincent is slightly higher, but there's some other factors going on in Guyana. It's also a bigger country. When the dean mentioned that the population of this university was 100,000, for someone who works in a region that, as Deborah mentioned, St. Kitts and Nevis, 52,000 total population. It's very interesting to imagine this university is bigger than a number of the countries that we cover. So, next slide. So these are some of the other problems that we're facing. Real struggle with data. Like, if you're trying to drive evidence base, you want to evidence inform, you want sound data systems. We just struggle to get data altogether. Many of the countries still use paper-based systems. And there's just not a real buy-in to that approach. It's a big push. Political will is mixed. We've had, like, for example, the Minister of National Security in Guyana uses evidence-based. He talks about how important that is. By contrast, St. Kitts and Nevis, there's an interest in supporting a Scouts program at the Ministry of National Security. So big variation in focus. So it's a tough thing. Tough economic environment. We're talking about, we're talking a region that is not recovered from the 2010 economic crisis, driven by tourism. Tourism hasn't come back to the degree that people wanted. So a lot of challenges there. I'm going to jump ahead. This is a more colorful picture of our region. So there you can see these are the 10 countries we cover. We zeroed in on the 3 that I mentioned, and I'm going to give you a rough accounting of why we picked those countries. I want to zip ahead, so that's my notes on that. So St. Kitts and Nevis, one interesting, St. Kitts and Nevis' homicide rate in 2001 was as low as 6, so pretty low. But by 2011, it had risen to 34 for the population. So if you extrapolate that for 100,000, because remember their population is less than 100,000, that puts them at roughly almost 68 per 100,000. So it's just gargantuan. But you start to wonder, you're also in a weird environment with such a small population. You start to wonder, is that statistic really a good one to be looking at? But we're also, it was a big issue. There's also a large amount of guns in there. A lot of report on guns used in murder is as high as 85%, which stands out. Then moving to St. Lucia. St. Lucia is sort of in what we consider within our region, we list it as sort of the third, when we exclude out Trinidad and Tobago, the third highest. So that's on homicide. It also has the third highest or actually I should say 5th highest. It's our third of our 3 countries. It has the 3rd highest within our grouping, or within the Caribbean, on robberies. It also has a high number of break-ins, and 3rd highest on rape. So we thought that was a big driver there. There's also a really strong interest there. There's a lot of, we got a really big buy-in from the government, which was really critical for us because we felt it was critical to have strong partnership with the government. And then Guyana, while it's lower on homicides, it's 2nd on robberies within the region. And we thought I know Thomas said we should focus purely on homicides, but we were looking at other crime and violence factors as well. So we were looking at a range of issues. So, next slide. So we arrived at what we call the Youth Empowerment Services Project. I should stress that we're talking about the pitfalls and the successes of public health programming. We're only 2 years into this. I should sort of warn you that what we know is still in the early stages. But what we arrived at is, first, component 1, we need to get better data. If we're really going to drive evidence-based, evidence-informed programming, we need to have better data in the region. We need to get, so we're focusing on ministers of national security, on police, and we're trying to, 1, improve the quality of data, improve the quality of analysis, and hoping that will lead to programming. Second was the project that Deborah spoke about earlier, the Community, Family, and Youth Resilience Program. That's where we have the primary, tertiary programming. This is where we've zeroed in on the 3 countries, but then we also zeroed in, like as they talked about in Honduras, on 5 communities in each one of those 3 countries. We thought it was important because there's really a paucity of other activities going on in these communities that we wouldn't just do secondary, but we would also do a robust primary programming that would range from looking at workforce development to after-school programs, and really trying to provide something, and also to build a strong community ownership and drive for the programming. So we wanted to build it or create what we call community engagement committees that would sort of drive forward the programming, identifying it, so it'd be a strong ownership as well. And then component 3 is a juvenile justice reform. So this is where we're looking. We had already been working on this. We thought it was important to continue it. It's our focus on tertiary. So we thought by bringing these 3 things together, we would sort of capture the key things we thought to move everything forward. So first I'm going to talk about CAR Secure. This is the evidence-based piece. So it's driven, this is broken into 3 components. I already talked about it. Collecting data. We've had some success here already. We've gotten an agreement within our region, action agreement from all 10 countries that we, on a set of indicators that we could use that would be standardized. So we got an agreement on indicators. We're trying to introduce the idea of looking at victimization data as well, recognizing that the administrative data does not tell the whole picture, that a lot of crime and violence goes unreported, particularly sexual violence. We're also trying to advance a standard classification of crime and violence, trying to use the UNODC model, and that's already been adopted in Trinidad and Tobago, and so trying to push that as well. On analysis, we're trying first to get a sense of what the trends are, because there's a real lack of understanding of what the trends are. We're trying to look at what the resilience factors are that might be influencing those trends. So protective factors, as Guillermo said. And we're also trying to help them start to think through, then what does that tell you about possible solutions? Really, we're going to have a group coming here related to this project later in May. And as Ed spoke today, I was thinking that we really need to get some of these ministries of national security and police to hear what the data shows so far in the United States, because I think there's a real lack of understanding of what needs to be done. But then we're hoping this will lead to how this will influence decision making. So we're talking about decision making as low as at the level of the community, police decision, where they put resources, what kind of programming they support, hoping it will influence into other non-national security related things, so influencing social programs as well. There's a big divide there with the way a number of the countries face that. And also trying to, in some cases, in one country there's a request for a nationwide security policy, so there's a potential there as well. We'll see. So what has worked so far, what has not? This has been the most, and this is no disrespect to CFYR, but it's become the most popular project within our coverage area. Mostly because it covers 10 countries, so it's been a big buy-in from all 10 countries, a lot of interest. And as a result, there's been a high level of national endorsement from all 10 countries. They bought into the indicators I mentioned, I talked about, they adopted the ICCS. But we're struggling as well. We have real sensitivity with data. And we've really had to talk a lot about how we protect it. In the case of St. Kitts and Nevis, we could not get them to agree to share with us juvenile data that we needed for an impact evaluation. So we had to basically say that we're going to have to exclude St. Kitts and Nevis, and they accepted that, but that was a real struggle there. It's been a really long, complex process to move this along, and we're talking about major change for a lot of, if you have a paper-based system and we're trying to get you into basically the 20th century with computers, and then and move them beyond that to really analyze. So there's a lot of challenges there. Next, so I won't speak too much about this project because Deborah spoke about it, but this is the Community Family Youth and Resilience Program that Creative is implementing. So we've got the triangle. This is our focus. So as Deborah described, we're focused primarily on primary and secondary. We had imagined there'd be a larger focus on tertiary, but we've had to scale that back because where we thought our juvenile justice project was proved to not be as far along as we thought it would be. But we're still going to do some work in Guyana where there's a real strong push for it. This gives you a sense of this is what's our theory of change. The first step is this big focus on getting the community involved, getting them to identify the problems, sharing the data we generate, do asset mapping with the community to sort of figure out what can we build on, what are the positive factors. And so then the next two boxes is this emphasis, not just looking at risk factors, but also really trying to look at protective factors and connecting that to, that's why we thought things like workforce development and some sort of educational programs that would be primary programming would be really critical to promote the positive and to really zero in on some early stage prevention work. And our theory is that all of this will lead to a reduction of violence. We plan also to be doing an impact evaluation, or we have an impact evaluation underway already, and both for this program and for the juvenile justice program. So the impact evaluation, much like the one in Honduras, is going to be really zeroing in on the secondary prevention efforts and trying to have both a control group and a treatment group, and measuring the impact of that. So progress and pitfalls here. Again, the project has been excellent in building a strong ownership within the communities. There's been a lot of interest. The risk assessment tool has been introduced pretty successfully. And Deborah mentioned how the difference between Honduras and us is that the governments are buying in to having the counselors themselves. What's interesting to us is when we designed this, we assumed NGOs were going to be doing that piece of work. The struggle in our area is there are very few viable NGOs. And as we got the project going, we just realized that was not going to work. And the governments were really interested in bringing them on. And we began to think about it and think that this actually might be a positive on the sustainability side, because we were able to, all the counselors that have been hired or that are going to be hired are going to be hired under the government pay scale. So it's not one of these classic development projects where the development workers are paid twice as much as normal government employees. They're brought in under the government pay scale with the idea that it would be quite easy to get them transitioned in. So as Deborah alluded to, next week we're going to be doing a sustainability workshop with the governor of St. Lucia, and we're going to talk about really mundane things, but really suggest a seriousness on their part of like, what's the specific classification we need to call this to make sure it can be picked up within our government system. So that's a positive sign. In St. Kitts and Nevis, we've already got an indication there where the director of the community the director of the Ministry of Community Empowerment that leads this aspect of the program has already indicated that she's already pretty certain she's going to be able to secure funding for 50% of these family counselors in year 2. So there's been strong buy-in there, and similar pretty strong buy-in in Guyana. So that's been, and so it's been really interesting to us that the secondary approach has been the piece that has been most quickly embraced by the governments. We had not anticipated that. We're finding that this, I think there's a real buy-in that this approach that we're really going to be able to, I think, within the next year, be able to demonstrate some real results from this project that will be applicable to the rest of the region, which is the other positive thing. So then the challenges or pitfalls. One, as was alluded to in the last one, we're in this struggle of primary versus secondary. As we face some pretty significant budget cuts going forward, we've had to really rethink what our budget situation is going to look like. And we've come to this recognition that primary is much more expensive. And we've been trying to think about, what can we do? And at this point, we're really thinking through, like, can we continue after school programming? What can we do on the workforce development side? Do we need to reframe it to have it focus just on kids that would be coming out of the secondary prevention program and not have it be as broad as we originally imagined? Should we make it more reduced, focus more purely on life skills? But we've recognized that I think secondary prevention, because there's a strong buy-in from the governments, we're thinking that that's likely to be the part that would remain. It's less expensive programming-wise. It touches on a much smaller number of people, but I think the argument is more focused programming has a much greater likelihood of reducing crime and violence. The challenge as a development organization people always want to look at numbers. So on primary, I can say I worked with 20,000 youth. With secondary, I can say I worked with maybe a couple thousand. So that may not sell as well to our senior political leadership. It's something that we're going to have to really work on selling, and it's something that I think we've already begun to lay the groundwork. But it's some of the tough challenges we're thinking through. Then second, this limited capacity to adopt and sustain new approaches. So very few NGOs, real varied capability within the government. We have some aspects, and some of the ministries work that are really capable, others that are less capable, and it's inconsistent across countries. So that's something we're trying to work through. We've had some tough, we're also trying to, while this is not a heavily police-focused program, the Car Secure project, the data piece, works a lot with the police on trying to improve their collection of data. And in St. Lucia, we can't work with the police because I'm not sure if you guys are aware of the Leahy Law, which prevents the U.S. government from working with any sort of security entity in which they've been accused of human rights abuses. And there was some extrajudicial killings that happened in 2010 in St. Lucia. Classic problem where the police went and killed the bad guys. They created little units that were tasked with this purpose. And St. Lucia has never prosecuted the people that did that. And this remains a big issue for the U.S. government, understandably. And so it limits our ability, or we're not able to work with the police there. And then the big challenge is, we talked about the small population. So we're trying to do an impact evaluation. We have to, because the population in none of these countries is sufficient when you look at the 5 communities to say that you could look at just one country. We have to, so our sample size brings all 3 countries together. So we're assuming that they're homogeneous, which they may not be at all. So that could be a real problem already right there. And it's making it, we're unclear at this point, going to Guillermo's point of how there's a much smaller number of kids that came out on the secondary level. We're not sure, as we complete the assessments, are we going to hit the numbers we need to make the impact evaluation statistically viable? So a number of big challenges there if you're trying to really promote an evidence-based view. Our premise, like what we say to our partners on the ground, the governments we work with, we want to walk the talk. We're talking about evidence-informed, but we also want to hold ourselves accountable, and that's why we thought doing impact evaluations were really important, but they're also very challenging. Next project, the Juvenile Justice Reform Project. So this is the second phase of this project. Basically, we zeroed in 3 areas. First, premise that if we can promote the use of diversion instead of detention, that would be a good thing. I think to Guillermo's point, when they talked about going into the juvenile justice detention centers in Honduras and finding a large portion of the kids being primary, same thing is true in our region. Made even worse that there's a mixture of populations in these detention centers of also kids that are in need of care and protection. They might be put there for being accused of wandering, meaning running away from home. So there's a real problem there. So we're trying to promote that. We are trying to promote the adoption of things like cognitive behavioral therapy in the detention centers. We've been doing some anger replacement therapy work. We've been trying to promote the use of risk testing, of mental health testing, a number of things like that. We're also trying to add a component of reintegration, recognizing that when these kids leave these facilities, they're going right back to the same communities where they face the challenges. So what sort of support we can give them to do that? So those are the things we're trying to look at. Also trying to train all the people that work in the justice sector. One of the challenges for juvenile justice generally for us is that in a number of these countries, you're dealing with people from as many as 6 different ministries. They cover the gambit of different responsibilities, so it's another tough issue. So we're hoping that this will lead to ultimately to reducing recidivism rates and increasing the kids being successfully reintegrated into their communities. So what are the progress and pitfalls here? we started, as I mentioned, the impact evaluation. We did a baseline assessment. And it was interesting to us because keep in mind that we are already roughly 4 or 5 years. This is the one project which is in a second phase. So there were 4 or 5 years where we've already worked on it. So we had felt that we had really secured this commitment to juvenile justice reform. So one of the big responses is saying, yes, everyone in the systems in the 3 countries uses the language of reform. They talk about restorative justice. They talk about rehabilitation, how important it is. However, they are not walking the talk. As many as 90% of the people of the youth surveyed that are in detention reported seeing kids in solitary confinement. As many as, well, actually 43% of the kids that were surveyed reported seeing excessive violence being meted out to the youth being held. That doesn't mean it does anything to them, but they're aware of it. And so it really made us realize, okay, we're not as far along as we thought we were. We had introduced things like risk assessment tools. We discovered that really only one country was really using that. That was St. Kitts and Nevis. So they were the one country who was applying mental health screening and risk screening. All the other 5, while they'd all been trained in it, just simply were not using it. And it's a recognition that a lot of the frontline staff in these facilities are not people that really have the skills, or not really, they're not coming from this background. They are, and there's a limited control of the people operating these facilities to change who their staff is. So that gets to this sense of old systems, hard to change, and this still the sense of a punitive approach to how you treat kids in the system. But when you have a broader region in which I would say, I think it's over 50% of people surveyed in the Caribbean believe it's okay to beat your child, then why would you think it would be any different in the detention center? So it made us sort of think like, okay, we're being a little bit crazy to think that we would have made as much a change as we thought we were in 4 years. So it made us really step back and think we really need to rethink what we can do and be more realistic. Again, limited national capacity, we've talked about that. Next, reintegration. This is something that we introduced in this phase 2. We thought this was a great idea. We thought we'd be able to connect, particularly in the 2 countries where we're doing CFYR, youth coming out of the juvenile justice system and put them into the programs that CFYR was doing. But we just sort of realized early on that or at this point, that the system isn't that well organized to do that, and they're not really ready. And that reintegration is going to be much harder than we thought, and that and the countries themselves are not ready to put the resources. We might be able to have some success in maybe a country like St. Kitts and Nevis, where you're working with such small populations that you can work on an individualized basis, but in other countries it may be hard. And just broadly, this sense that it's a long and complex process. So that is everything. Thank you very much.
And I'm going to take questions at the end, if that's right, after the other 2 panelists. So next we have 2 folks from DAI. We're going to focus on Honduras. Antonio first started his career in government in Caracas, where he was looking at some of these issues for his country. Later on, he worked in over 15 countries designing democracy and governance programs for USAID, culminating in leading USAID's crime and violence prevention program in Mexico. So recently he has come back to DAI. Ana Suazo, I'm very happy to say, has recently also joined DAI, but she brings 6 years of working in Honduras with the National Police on the implementation of the Honduras community policing model in high-risk communities. So really on-the-ground experience. Very nice compliment. Antonio?
Thank you very much. See if we have the presentation here. Go and get this.
The clicker.
Well, thank you very much, and thank you, Chuck and colleagues in ASU for inviting us today. It's a great pleasure to be here and talk a little bit about what we're doing in the AI most recently, and share with you some of the experience that we have also in the field, specifically in Honduras, where we are currently implementing a couple of projects that relate to the area of citizen security. One, the Justice Security Human Rights Project, where Karine is working with us, and also the School-Based Violence Prevention Project that also is recent. It's been implemented since 2017, and it's also, we believe, a very interesting component of the overall citizen security strategy of the mission in Honduras. But as part of that, I want also to share with you a kind of a bigger picture perspective on that change a little bit the discussion that we're having today here, and share with you also a little bit of what we are doing currently with USAID. Is a very small paper that we've been commissioned through the Rule of Law IQC that is looking into the relationship between citizen security and justice as such, and is a specific task that is looking for informing USAID missions basically to understand better whether there is a relationship there, whether also put some order in terms of the definitions, some concepts, and see how this sort of interventions in both areas can fit together, if there is any relationship at all or not. Interestingly enough, during the conversation today, I was sharing with other colleagues that at the very beginning of the conversation, we were limiting a lot of this discussion to specific, I would call it legs, Guillermo mentioned before, a few legs of the whole composition of what we do in this field in order to achieve crime and violence reduction. And we came from crime violence prevention to law enforcement and police enforcement and work, and then later we started talking more about other aspects of what is needed to really evolve into the discussion of how to achieve the results that we want. And started hearing more in the afternoon about juvenile justice issues in Honduras that Proponte Mas is including into that portfolio. But Ted just explained to us is great, is taking a bigger picture also in connecting different aspects in the equation. But still, there are other elements in the equation that comes, and they're related to reduction of impunity and also access to justice that seems to be part of, should be part of the conversation as well, that we are trying to identify through this analysis we're doing. We're just starting with analysis. I just wanted to present to you summary findings that we have and kind of the direction where we want to go. I'm hoping that we have here a group of talented colleagues with a lot of experience also to collect from you some of your impressions about what the direction of this analysis should be. So the way we're starting the analysis is mostly in using this continuum of citizen security that most of you are familiar with. And it's basically, we've been talking today about most of these elements, from prevention, we've been talking about culture of lawfulness and peace and conflict resolution that happen at the community level, law enforcement and security, and some elements of justice, and some elements also of what happens at the jail system or penitentiary system. So we add to that the importance of also taking into account human rights issues or elements, as what we're trying to do precisely is to come with a kind of preventative approach that will try to look at the system from the very beginning with a different lens. It's not only punitive, but also it's trying to build, as we heard in one of the presentations earlier in the morning from Scott, which I like very much, when they talk about the important role of how all of this is perceived at the community level that we cannot get or enter into the communities without taking into account that we need to build social cohesion there. So that's a very important element of it. And I would say that, yes, we want to, at the end of the day, reduce homicides, but also we need to build or go through the building blocks that are needed in different levels of intervention to gain that legitimacy also that Tom was explaining this morning as well. And that combine that with effectiveness that is related to bringing down the services that are related to what the communities want to receive. So this continuum, in a way, is trying to put some sort of a framework to organize a discussion and see from what perspective are we talking about. Are we just talking about a prevention? Are we talking about law enforcement prevention, some elements of justice, all of them, and where are the convergence points that will allow us to really identify and design programs that at the end of the day will be more effective. Robin was talking earlier before about the importance of integrating activities under the PBS strategy, the territories where we work. I guess what it means is not only about coordination, it's about really finding common grounds across the continuum and where we're going to meet and how we're going to make this project more effective. So as part of what some of the interviews we're doing and literature review that we have conducted, and for me this is a wonderful also way of capturing information by listening to some of the presentations and seeing what are we doing in different places in the region. We are finding some challenges and trends, and one of them one of the interesting findings and at the same time represents a challenge, is this kind of stovepipe approach that we're finding, where when we look at the continuum, the traditional projects, and we all have been there for years trying to learn, as you have been also sharing during the other presentations and how that work. We found that at some point we were basically focused on only crime violence prevention. At some point, most of the projects were related to primary prevention. Now there's been some evolution into going up into secondary prevention and some tertiary prevention. But yet we're just talking sometimes projects or programs that are isolated and also only talking about prevention. From the justice perspective, we are seeing, especially when you're coming from the rule of law perspective, and that a lot of the emphasis in many projects has been more related to big reforms, case management approaches without taking into consideration what's going on at all levels of the continuum. To integrate those interventions and match them with what are the fundamental aspects of the interventions under city security. We were talking before about the focalization importance of this, that you can see when you start working on place-based strategies as territorial behaviors and demographics. So sometimes these justice projects and approaches are building a focus on the system at the macro level, case management, or putting a lot of attention on training of prosecutors or training of judges, but without paying specific attention on how these connected dots that are important to relate to the work that we are doing also at the community level, that we are also doing in other aspects of the continuum with the police, that will help to start improving the communication among these different sectors in this continuum. So in that sense, and the other element of a challenge that we're seeing as well is that the thing is mentioned before here is the lack of trust in a limited presence of state actors that undermine legitimacy of communal level interventions. Often we found that these interventions that talking from the perspective of justice interventions that are not taking into account what exactly are the specific realities or contexts within communities, that are not bringing with them specific services that will help to improve access to justice, in a way, are disconnected. As we were talking to some colleagues in Mexico, for example, one of the main concerns that we found is that they've been spending years in training prosecutors to move them to the new system in Mexico. And prosecutors were always doubtful about engaging with the communities and looking at how they can understand the reality of the communities and how to work and engage with them. So moving forward, we're trying to identify is how we can make this continued work better in terms of the overall programming, in terms of also how this can be taken to the policy level as well, understanding or identifying those convergence points in this continuum. And some of the preliminary ideas that we're talking about today and that we could see already that are happening in projects in the region, some of them have been exposed and presented today, are related to the connection with the state presence through access to justice services at the community level, but also that take into account the populations or those populations that we are trying to, that are targeted in terms of the importance and the focus of focalization that we need to do in our projects from the perspective of civil security. In this sense, the justice program in Honduras is really putting a lot of attention into the connection of issues of access to justice that have to do with vulnerable populations, and Karina will be talking a little bit more about it, and how the project is trying to really engage at that level with the idea also of connecting those vulnerable population with more specific programs that will address not only risk factor, but also that will give them access to the justice system, but also that will, in a way, help to reduce impunity. Another area that could work as a convergence point, as we are looking at, has to do with the focus on the community level, understanding what's going on there, and how to really make it work at the territorial level, and come and take down a little bit this macro sort of reform processes where a lot of investment is taken into improving processes within the system and actually connecting them with specific interventions that are related to all the different aspects of the continuum that engage the police, the justice system, and also prevention actors in the communities. In this, an example of this kind of integrated approaches, I can talk a little bit about what we're doing in the school-based and violence prevention project in Honduras. That although this is an education-based project and is based on education systems, it is also connected to citizen security indicators. And as we're working in that project, while we're building prevention and programs within the school systems, there is also an effort to connect with other actors, external actors in the system that include the police, the court system, social services that are in the community that can in a way connect to these elements. So there you can find that you could leverage from any of the other elements. We're talking about the judiciary, we're talking about the law enforcement. You could engage actors at the community level, identify them in the system very early on as part of the programs that exist in the school level, and then work with them all the way to the system. So say that a young person in Choloma get in trouble and is identified by a law enforcement and a police element in some moment, that person could, if that police using community policing approaches is in the community, understand what's going on at the school and knows that there is a CBT intervention in that school, they can immediately work with that kid and try to make their intervention more iterated by working with the school system to avoid that kid going to the system, to the court system, jail system. So another area that is something where we need to do a lot of conversation in the near future has to do with the identification of common indicators that can also help us to define what are we doing as a whole in the different projects where we are. It's not only about what are we doing individually as a project, but what together in these interventions that we're doing in specific territories, especially when we're talking and working on PBS, under the PBS strategy, what kind of indicators we can define together that will be helpful to also measure the overall impact of the project. So with that, I will pass to Ana Karina, who is going to be talking more about the Justice Project and give you more details about this approach.
So I'm not going to stand in front of the podium because I'm too small. You probably won't see me. So I've been working for a short time in this program, Unidos por la Justicia. It's a human rights program that seeks to improve security and the conditions to reduce crime in certain communities in Honduras. So the background of the program is that it provides a holistic approach to USA's place-based strategy. We focus on vulnerable groups in general. We focus on 5 specific groups, which is women survivors of gender violence, LGBTI groups, people with mental and physical disabilities, and ethnic groups and youth. So the holistic approach of this program seeks to work with not only community police, not only with justice operators, but also with the justice institutions and civil society in general. It is a 5-year program, and it is focused on 5 specific cities in Tegucigalpa, San Pedro, La Ceiba, Choloma, and Tela. So the program objective is to improve citizen security and the conditions to reduce violence in target areas. Okay, so I'm going to focus on this Venn diagram. Like I said, we have citizen security, we have civil society, and institutional strengthening. We want these 3 different groups to interact in a very efficient manner. Our first approach is for vulnerable groups. We want vulnerable groups to feel empowered, to know their human rights. This has been difficult because vulnerable groups have suffered from endemic levels of violence in Honduras, and these levels of violence become exacerbated when they seek legal assistance, or they try to report a crime, because more often than not, sorry, I'm a little nervous. More often than not, justice operators, they try to blame the victims, or they try to re-victimize these groups for demanding justice. They think they are led to believe that it's their fault for a crime has committed to them, and it has been their fault. And also, we heard earlier that they become desensitized to what is happening around them. This occurs especially when they seek legal assistance, because they think that the justice system just doesn't work for them. It's so inefficient that they will never receive justice when they report a crime. So they think that the justice system just works that way. What they don't understand is that because they're part of these vulnerable groups, they do not gain access just because they're part of these groups. That is why we're focusing on them. So we need to rebuild the trust between civil society and justice operators. We started this program with community police because that is the first justice operator that they encounter when they want to report a crime, and it's also the first operator that historically has violated their human rights. So we need to rebuild that trust, and what our program does is that it creates the spaces, a safe space, so that these vulnerable groups can talk to justice operators and begin a dialogue and begin to heal what has been done to them. So, and right now the community police, well, the National Police of Honduras has adopted this model of community police. Their whole philosophy of how to engage with communities has changed. They accept it. They have accepted their past. They have undergone a very tough transformation process, because around 5,000, maybe my friend Messi Aguilar can help me, but it's about 5,000 police officers have been separated from the National Police because they have been accused of being engaged in illicit activities. So now that we are beginning to rebuild this trust, it cannot work only by itself. It needs also to be supported by efficient institutions that can provide, that can prevent and punish crime after it has been reported. So, one of the activities that I like to show to present the trust that has been done. For example, this is a community fair that was done in San Pedro Sula, and to get to this picture, it was a long process. It wasn't only that they did a fair, they took a nice picture, and it goes up on USA's wall, but it's a picture that says that the LGBTI group, as well as people with disabilities, talked to the police and told them, this is what has been done to me. I have been violated. I have been imprisoned just because of being part of these vulnerable groups. And after this dialogue began, and they began to heal, like I said, now they are willing to engage in a conversation that will contribute to build security strategies that are more assertive for these vulnerable groups. Now, going back to the Venn diagram, we have the institutional, the justice sector, where we want to work with, we want to improve the efficiency of these institutions. And like Antonio said, that we want also to work specially with those programs that allow these three circles to interact. So one of the first projects that we're trying to support are the SEINs, which is the integrated centers. Integrated centers are places where people can go and report a crime, and they have police officers, they have legal assistants, and they have legal prosecutors and defenders all in the same place, and they can help the victims navigate through the whole legal system right in the same spot. So it's like an all-in-one shop, and we want to make that a lot more efficient and more accessible to everyone. Another pilot project that we want to do in order to begin to break those barriers for vulnerable groups and so they can access justice is a pilot program to train interpreters for those people who cannot speak Spanish, especially there's an ethnic group, there's the Afro-Honduran group. Not all of them can speak Spanish. So they cannot report a crime just because somebody in the legal system cannot receive this information. So it is important to incorporate translators, as well as the people who are hearing impaired. Here's a picture of Zulma Valencia. She is one of the advocates for ethnic rights in La Ceiba. She has also worked very hard to help name an ethnic prosecutor in the legal system. This is very important because it provides the grounds so that we can start pushing public policy that is in favor of vulnerable groups. So going back to this diagram, we want a strong civil society, and strong communities so that they can engage with justice operators to build security strategies that are assertive, that are more targeted, that are built on what the community needs and not what the police or justice operators think that they should do. And also, they cannot build strategies without the beneficiaries, which is what we have been hearing a lot, that we cannot come from the United States to apply the same models in other countries without the input of the beneficiaries. So this is the same concept. They cannot, justice operators cannot build security strategies that that are not socialized and do not incorporate the opinions or the inputs of civil society. And in turn, also working with very efficient and strong institutions by improving, like you said, the collection of data is very important to improve the technology so that they can collect data and have and take decisions based on evidence, as well as strengthening the forensic medicine department, where once they start the legal system, that they can actually prosecute with strong evidence. So to close, this program is not to reduce homicides. It does not depend on one single program. Like it depends on the inputs of the whole international community. The place-based strategy that is its main goal to reduce crime and create access to justice and focus especially on reducing homicides. But it cannot be, no program can say this was my own doing. So it is very difficult to say that our indicators have contributed directly to reducing homicides. So it is important so that justice operators, civil society, international communities, and strong and efficient government institutions work together to improve citizen security. Thank you.
I'll open the floor for questions. You first.
Sure. It's okay. I don't need a so this is more, I guess it's somewhat of a compliment and maybe a reflexive critique, but to kind of, in being just a little bit, a little familiar with Unidos por Justicia and the program that Ana Karina was just referencing, I think I kind of just want to underscore this notion of designing a justice system around vulnerable populations, because it's something that perhaps in the U.S., if it was something that is emphasized a lot, there could be a lot of gains from it. Where if police courts and corrections, from a systems perspective, is designed around or kind of puts at the very forefront your vulnerable populations, defined, of course, in the context of whatever country or nation state we're talking about, that the measures related to violence and measures related to citizen sort of safety, security, and quality of life will in turn, or as a theoretical principle, would be expected to improve. And so I think it's wonderful. I don't know, it's central in the documents of Unidos por Justicia, but I guess I'm not getting paid for this. Just for some odd reason, I'm kind of promoting the Unidos por Justicia initiative. But I just think it's fascinating to kind of emphasize this sort of integrative approach to citizen safety and security.
I think that's great, and I'm just going to, before I turn it over, just let you know, I'm old enough that as someone in law school, we were involved in the first law clinics that helped women, LGBTs, etc. And that did happen a long time ago. We have still a long way to go to actually integrate them, but I think it's a great question.
Thank you, Kenneth. Well, I agree with what you say. If we create access to justice for vulnerable groups, then in turn it'll provide access for everyone else. Let's say like a person who is not part of the LGBTI group, but if a police officer can treat very well somebody that belongs to the LGBTI group and is sensible to their needs, then consequently he will be sensible to everybody else's needs.
Yeah, this is for Ted. Okay. I'm just curious about you, we're talking about looking at some risk differentiation with the juvenile justice community, with some of the people involved, juvenile justice, the kids in the system. Can you talk a little bit about how you're looking at, are you using the Y-set at all for that, or what are the tools that you're using?
The tools that are being used in the juvenile justice system is the SAVRI tool. It's, I think, developed in Massachusetts. The idea is it's more comprehensive, and the concept was that for kids already in the system, you would need a more complex tool. And that the great value of the Y-set is it's a more simple one that can be used by people with less training. I think the SAVRI requires you have a clinical psychologist review it or some of the certain level of training. So it's used in the actual detention centers. They also use the MAZE, which is a mental health screening tool. So, and it's so far, it's successfully being used in St. Kitts and Nevis. We're hoping it'll be used in others.
Great skill. A close friend of mine made it, so I have to plug that. So I just have two comments. No answer for you, just commentary. I haven't said anything all day, so I figured I gotta say something. That is the most ambitious project I have ever seen in my entire life to pull off. Period. The more general comment is I appreciated very much how you talked about what's working and what's failing. Because too many people they pick one or the other. And I think you've been realistic about what you're trying to do, given what you are trying to do. With that, is there a low-hanging fruit that you can say, hey, let's go attack these things because we know we can pull these things off, but we're not going to change juvenile justice reform in these two countries anytime soon. It took the United States 150 years, and just in the past, between 2005 and 2010, to come up with 3 Supreme Court cases that turned the tide about how we dealt with juvenile offenders in this country. So you're trying to do a lot so I just wonder if there's some low-hanging fruit that you can pick off that it might be successful.
I think you're right. Like I reflected a lot when the Spergel model was mentioned multiple times today, and I began to wonder myself, I wonder to what degree we're falling into that trap. On our juvenile justice project, we tried to zero in on diversion specifically, and trying to focus on trying to identify what diversionary programs exist. One of the problems we realized in the first phase, kids were being diverted, but they weren't being diverted into anything that was really rehabilitating them. So we're trying to see where we can support that, and deciding, like I should stress that project, the Juvenile Justice Project, focused on the 6 Eastern Caribbean countries. But we may not build we're going to really zero in on which countries are really advancing that, which are not. And there's some interest there. And then focusing more on, looking at some of the detention centers that seem to be more forward-looking and see if we can really make sure that, for example, the ankle replacement therapy really becomes institutionalized and is used. And sort of, we're going to hoping through a collaboration with Northeastern University is to support some country-level mini impact evaluations. So, for example, St. Lucia has identified an interest in trying to figure out what's the impact of ankle replacement therapy. And so try to develop, sort of test it, because when we did the baseline assessment, and all these people say, oh, ankle replacement therapy, really like the program, but I don't really think it has any impact. You sort of thinking to yourself, why do you say you really like the program if you're then saying you really see no difference? The only place they could say they saw a difference was in Nevis. In Nevis, just to give you a context, there are only 12,000 max that live on Nevis. So when you mention Tivoli Gardens as a small community, I think to myself, well, one of the islands that we cover is smaller than that. But they applied ankle replacement therapy in primary school. And the preliminary results were that it was having some impact. So we're trying to explore, okay, if that's working, can we promote that being expanded? So we're trying to embrace that. But I think you're exactly right. I think we probably are overly ambitious. Like, one of the things I sort of failed to mention during my thing, as we pulled this together, and Risa and I pulled this presentation together, one of the things our big questions that I failed to mention is, are we naive to believe that in a 4 to 5 year time scale we'll advance this? But I think this comes back to an earlier point someone made is, USAID, probably like lots of other development agencies, will say things like, we recognize that development takes time. But the longest amount of time we're usually able to give something is 4 to 5 years. And I think I can be honest, because I designed this with my team, we knew flat out that we weren't going to get where we wanted to in 4 to 5 years, but we had to say we were. And then we thought, assuming we'd make progress, that then when you get towards the end, you then say, let's extend the strategy for another 4 to 5 years so we can really make real progress. We've already shown this. But we also pick things like, it's why we really were intrigued by the focus on risk. Because we thought, okay, that's something where, I think the evidence that Creative has been able to generate is, it looks like within a 6-month to a 12-month cycle, you can see a reduction. And so that's why I think I sort of stressed that we're really struck by that a lot of the governments we're working with, because I didn't stress that well enough, is that the other part of this is, USAID is trying to have big ownership of these programs. So Creative is one of our implementers, but we have 3 different implementers, and we have monthly meetings, but we also have quarterly meetings in each one of the 3 focus countries, which we are co-chair with the government counterparts. So like, for example, in St. Lucia, really active, dynamic, permanent secretary for the Minister of Equity, very active, and he effectively leads the group. And that's who we're going to have the sustainability workshop next week. But trying to sort of get their buy-in and support and participation, I think that's been a really big part. But the challenge is trying to also work with all these different stakeholders as well, who all have different interests. And they all have valid interests. So they're not like that they don't have valid interests. But they're also mixed as well. So I think I've rambled on for a while.
Ted, could you maybe just talk about CDCS? Because a lot of people think USA just makes up these strategies.
So
You're in the most complicated, geographic area, though.
So it's a country development. What does it mean?
Cooperation
strategy. We change what we name things every 5 years, and I've worked for USAID coming up on it's now almost 15 years. So I've gone through 3 or 4 different names of what we effectively say is our strategy for the region. I find it easier to just call it the strategy. So what do you think is really interesting? Because I don't.
I just think that we don't. USA doesn't start from scratch. They talk to the countries. I just think that's something that outside of USA people
and that's
don't
a good
understand.
point, actually, particularly for this strategy. For the strategy, and then for the follow-on, what we call project appraisal document. But that was sort of the core of what all the thinking behind this came from. We spent a lot of time in consultation. So just to give you a sense, as we identify these countries, we were going to each one. We went actually to communities. For example, I went to, during the sort of design phase, I went into a number of the communities we had identified already as being the hotspot communities, met with people in the communities, got a sense of what they're interested in, because we really felt like, going to that point of, you have to recognize what the assets you can build on. We really thought it was critical to figure to what degree there was strong country ownership. Because we really approached this as a partnership that we really were trying to promote practices that we wanted the countries to pick up themselves. So one of our big factors was what degree of buy-in was there from that country. So in each one of the 3 countries we picked, there was a pretty high level of buy-in.
Question? Successes.
I think you're right. I reflected a lot when the Spergel model was mentioned multiple times today, and I began to wonder myself, I wonder to what degree we're falling into that trap. On our juvenile justice project, we tried to zero in on diversion specifically, and trying to focus on trying to identify what diversionary programs exist. One of the problems we realized in the first phase, kids were being diverted, but they weren't being diverted into anything that was really rehabilitating them. So we're trying to see where we can support that. And deciding, I should stress that project, the Juvenile Justice Project, focused on the 6 Eastern Caribbean countries. But we may not build like, we're gonna really zero in on which countries are really advancing that, which are not. And there's some interest there. And then focusing more on, like, looking at some of the detention centers that seem to be more forward-looking and see if we can really make sure that, for example, the ankle replacement therapy really becomes institutionalized and is used. And sort of, we're gonna hoping through a collaboration with Northeastern University is to support some country-level mini impact evaluations. So, for example, St. Lucia has identified an interest in trying to figure out what's the impact of ankle replacement therapy. And so try to develop, sort of test it, because when we did the baseline assessment, and all these people say, oh, ankle replacement therapy, really like the program, but I don't really think it has any impact. You sort of thinking to yourself, why do you say you really like the program if you're then saying you really see no difference? The only place they could say they saw a difference was at Nevis. In Nevis, just to give you a context, there are only 12,000 max that live on Nevis. So when you mention Tivoli Gardens as a small community, I think to myself, well, one of the islands that we cover is smaller than that. But they applied ankle replacement therapy in primary school. And the preliminary results were that it was having some impact. So we're trying to explore, okay, if that's working, can we promote that being expanded? So we're trying to embrace that. But I think you're exactly right. I think we probably are overly ambitious. Like, one of the things I sort of failed to mention during my thing, as we pulled this together, and Risa and I pulled this presentation together, one of the things our big questions that I failed to mention is, are we naive to believe that in a 4 to 5 year time scale we'll advance this? But I think this comes back to an earlier point someone made is, USAID, probably like lots of other development agencies, will say things like, we recognize that development takes time. But the longest amount of time we're usually able to give something is 4 to 5 years. And I think I can be honest, because I designed this with my team, we knew flat out that we weren't going to get where we wanted to in 4 to 5 years, but we had to say we were. And then we thought, assuming we make progress, that then when you get towards the end, you then say, let's extend the strategy for another 4 to 5 years so we can really make real progress. We've already shown this. But we also pick things like, it's why we really were intrigued by the focus on risk. Because we thought, okay, that's something where, I think the evidence that Creative has been able to generate is, it looks like within a 6-month to a 12-month cycle, you can see a reduction. And so that's why I think I sort of stressed that we're really struck by that a lot of the governments we're working with, because I didn't stress that well enough, is that the other part of this is, USAID is trying to have big ownership of these programs. So Creative is one of our implementers, but we have 3 different implementers, and we have monthly meetings, but we also have quarterly meetings in each one of the 3 focus countries, which we are co-chair with the government counterparts. So, like, for example, in St. Lucia, really active, dynamic, permanent secretary for the Ministry of Equity, very active, and he effectively leads the group. And that's who we're going to have the sustainability workshop next week. But trying to sort of get their buy-in and support and participation, I think that's been a really big part. But the challenge is trying to also work with all these different stakeholders as well, who all have different interests. And they all have valid interests. So they're not like that they don't have valid interests. But they're also mixed as well. So I think I've rambled on for a while.
Ted, could you maybe just talk about CDCS? Because a lot of people think USA just makes up these strategies.
So
You're in the you're in the most complicated, like, geographic area, though.
So is a country development, what does it mean?
Cooperation
Strategy. We change what we name things every 5 years, and I've worked for USAID coming up on, I think, it's now almost 15 years, so I've gone through 3 or 4 different names of what we effectively say is our strategy for the region. I find it easier to just call it the strategy. So what do you think is really interesting, Anne? Because I don't.
I just think that we don't. USA doesn't start from scratch. They talk to the countries. I just think that's something that outside of USA people
and that's
don't
a good
understand.
point, actually, particularly for this strategy. for the strategy and then for the follow-on, what we call project appraisal document, but that was sort of the core of what this whole, all the thinking behind this came from. We spent a lot of time in consultation, so just to give you a sense, like, as we identify these countries, we were going to each one. We went actually to communities. For example, I went to, during the sort of design phase, I went into a number of the communities that we had identified already as being the hotspot communities, met with people in the communities, got a sense of what they're interested in, because we really felt like, going to that point of you have to recognize what the assets you can build on. We really thought it was critical to figure to what degree there was strong country ownership. Because we really approached this as a partnership that we really were trying to promote practices that we wanted the countries to pick up themselves. So one of our big factors was what degree of buy-in was there from that country. So in each one of the 3 countries we picked, there was a pretty high level of buy-in.
Question? Two quick questions, one for each of you, one for Central America, one for the Caribbean and one for Honduras. Ted, you mentioned at one point that you were getting squeezed from a resource point of view.
Yes.
I was intrigued by that because these aren't gigantic countries. You're not talking about a lot of people. And I don't know if the level for the Caribbean is, which I heard is around $50 million a year. Maybe this is an inside baseball question, and maybe you want to address it offline, but I'm just intrigued as to why this particular program, that sounds so good, would get squeezed.
So
And then
just
I
to
have
give you a
100.
sense, like we're thinking, I think we're told that of that 50 million, you're talking about that we will get perhaps about 8 million, of which we need to divide between these 3 projects.
Yeah, but they're really tiny places.
Okay? They are small countries, but working across 3 different countries is difficult. I guess we're talking about, like, when we did a rough estimation of like what does workforce development cost, and the sort of scale we wanted to do across, we're focusing the workforce development, all the programs we're talking about in that vein are focused on the specific 5 communities we're talking about. We figured it would cost about $1 million a year across the 3 countries for that alone. Another $1 million for the after-school programming and a lot of the other programming we wanted to do. So it's just expensive. The cost of doing comprehensive programs is high. I think it's high in the United States. It's high in other countries as well. $50 million is not that much money, and it's divided up between multiple different countries. It's not just USAID, it includes INL, some of it goes to the military, some of it, because there's a whole range of things covered under the Caribbean Basin Security Initiative. We cover what's called Pillar 3, which zeroes in on they call it social development. We call it preventing crime and violence. But the other parts are more law enforcement and military cooperation. So in our sense, to give you a sense, when we planned the CFYR project that Deborah leads with and Creative as the implementer, we planned that it would be $38 million over 4 years. So at this point, we're thinking that we will come up like $10 or $15 million short. The UNDP project we planned, that would be $14 million over 4 years. At this point, we think we'll come up $7 million short. And then the Juvenile Justice Project, which is the smallest, budgeted about $6 million. We're thinking we'll come up about $2 million short. So we had envisioned, based on, there's a recurring problem, is that we operate on year-to-year budgets, but we strategize over 5 years. So when we designed this, we were designing it under a different administration that put more funding into this area. And so we had planned for more robust budgets. And I just think it's hard to maybe explain to you why certain things cost certain amounts, but it costs a fair amount.
I would only add that I wouldn't worry too much when you get to 4 years justifying a continuation, as long as you can show the solid progress.
No, and that's the spirit. I think that's what we're really trying to focus on. I really took to heart what Thomas said. Will we reduce homicides? I'm not sure if we'll have done enough in the time period to really have a noticeable impact on that. Will we see reductions in other levels of different other types of crime? I'm not sure. I think we're pretty confident we'll be able to show reductions in risk. But it's the challenge of what will we be able to show, and what will be the United States government's priorities at that point as well, because they're constantly changing, and we recognize that in a tough budget environment, this is not the only game in town. So we're trying to. Our goal is to present a compelling case, but also as Deborah mentioned, Risa and I and Deborah are all going to be working next week with the government of St. Lucia on sustainability, because we're trying to see what can we get. Our idea was you don't wait until the end to think about when you get taken over. You start from the very beginning. So we're not quite finished year 2 of a 4-year project, but we're already meeting with government to talk through the mechanics of what would it take for them to pick this up. And we've already gotten, I think, a lot to Creative's credit, was really successful to get this 25% cost share on the family counseling at a much sooner point than we had imagined. So there's a lot of positive things there as well.
With regard to Honduras, very quickly, 2 questions. One, I know you mentioned international buy-in. I'm wondering what that international buy-in may be besides the United States. And secondly, since everything is connected to everything else in life, including what you're reading in the newspapers, what is the impact of the United States returning Hondurans to Honduras? People who no longer enjoy the temporary protective status and others. What kind of impact, if any, is that phenomenon having on what you're doing?
So, can you hear me?
Might have run out of battery.
Hi. So the other international programs that, besides USA, that work in Honduras, one is called Eurojusticia, which is from the European Union. They work a lot with improving technology and with the whole justice departments. They try to get the judicial system, the public ministry, and national police to try to communicate together with the same languages, the same information systems, and to share information and to also capture data. Also, there's also the Japanese International Development Organization that works with justice operators as well. They started a long time before USA working with community police. So there are a lot of different international programs that can help support this same objective of reducing crimes and improving security. And I can take an educated guess to your question about what would happen if all these people who are in the United States decide, or Trump decides to send them back to Honduras. Currently, Honduras does not have the network to receive these people and to incorporate them back into the communities with jobs or housing. They would be in a very precarious state if they decide to return more massively than they are returning right now. Because right now, I think from what we are in April, probably about 20,000 migrants have returned this year alone, and every year it increases and it increases, and about 60% of these people decide to go back to the United States and try their chances again, because there is no network to receive them. So it would be, I think it would worsen the conditions than they are now.